Today we'll be performing a head-to-toe assessment for Nursing 383. I'm going to begin by washing my hands and then doing a general survey of the patient, looking for any signs of distress, his general appearance, his height, his build, his hygiene, making sure his dress is appropriate for the situation, and assessing his level of consciousness by asking, can you state your full name?
Daniel G. Sidbeck.
Okay, and the president?
Barack Obama.
Okay, good. By this I can tell that he is alert and oriented, his speech is within normal limits, and he can follow simple commands. I'm then going to inspect his skin and his nails. So I'm looking at the color, the texture, any lesions on the skin. I'm looking at his nail beds, and they're all normal, and I'm looking for any edema. I'm also palpating for moisture, texture, turgor, and elasticity, and I would do that in the other hand as well. Next, I'm going to inspect the head and the neck. So I'm looking at his hair for equal distribution and if his hair is brittle or anything. I'm looking at the scalp for the color, any lesions or discoloration, and I'm assessing for pain when I palpate the scalp here. I'm then looking at his facial features for symmetry and size, and that's good, and then I'm going to palpate the frontal bone, or the facial bones. I'm going to assess the temporal arteries. And they are equal. I'm going to assess the jaw, can you open and close? Good, and there's no clicking there, and then I'm going to palpate the frontal and submaxillary sinuses there. I'm then going to assess cranial nerve 5. So with this Q-tip, this sensation will be sharp, and this will be soft here. So I'm going to touch your chin, your cheeks, and your forehead, and you tell me what you feel, okay?
Soft.
Okay.
Sharp.
Okay.
Soft.
Okay.
Sharp.
Good, and I can tell that cranial nerve 5 is intact here. And can you close your jaw? I'm testing for strength here. That's good. Okay. Then I'm going to assess cranial nerve 7, the facial nerve, and I'm going to assess your symmetry or facial movement. So if you could smile, frown, puff out your cheeks, purse your lips, wrinkle your forehead, and close your eyes still tight. Okay, and that is all good there. Okay, and then I'm going to look at his eyes. I'm looking at his eyebrows and his eyelashes for equal distribution of hair, and I'm looking at the upper and lower eyelids. I'm looking at the conjunctiva, sclera, and the iris as well. I'm then going to test cranial nerves 3, 4, and 6 in the eyes. I'm first going to look at the size, shape, and equality of the pupils, and that's good. And then I'm going to check the 6 cardinal positions of gaze. So if you can keep your head straight and just follow my finger with your eyes. Okay, good. Next, I would dim the lights, and I'm going to shine a flashlight in the eyes to check for direct and consensual light reflexes. So I would shine a light in this eye, and look, and then in the other eye. And then to test consensual light reflexes, I would look in the opposite eye of what I shine it in. Okay, very good. Now if you could cover your one eye and look at my finger and then look off into the distance, back to my finger. Okay, good. And then we would repeat that on the other eye. Now, if you can follow my finger in and out from your nose. Okay, good. I can tell by this that his pupils are equal, round, and reacted to light and accommodation. I'm then going to assess cranial nerve 2. For his visual, I would test visual acuity during this, so I would have you cover one eye, and I would have you read something from close up and far away, and then we would repeat that on the other eye as well. Then I'm going to test peripheral vision. So I'm going to be like wiggling my fingers and you tell me when you see them from the side, okay? So, you see them?
No.
Okay.
No.
Okay.
No.
Okay.
No.
Okay, good. go to the ears, and first I'm just inspecting them for symmetry from side to side, the shape, and the other characteristics. I'm then going to palpate the auricle tragus, the mastoid, and the surrounding tissues on both ears here. And I'm looking to see if when gently pulled back there's any pain.
No.
Okay, good. And then I would do an otoscope examination of the tympanic membrane and look for landmarks such as the manubrium and like the manubrium through the translucent membrane there. So then I'm going to test cranial nerve 8, the acoustic nerve. So I'm going to have you cover this ear, and I'm going to whisper something, and then you tell me if you can hear it. Okay? Did you hear that?
No.
Okay.
Yeah.
Okay. What was it? 88? Okay. And then I would repeat that in the other ear as well. So now I'm going to move to the nose, and I'm just inspecting the nose for symmetry, and then I'm going to palpate the external nose there. And I'm going to have you test it for patency, so if you could close one nostril and sniff. Okay, and then on the other side as well. Okay, good. And then with an otoscope, I would also look in his nose for the mucosa, at the turbinates and the septum there. I'm then going to move to the mouth and the pharynx. I'm looking at the lips, and they should be pink and moist there. I'm looking at the teeth for dentition, and if you could just open your mouth and looking at his gums, they should be pink, and his oral mucosa should be moist there. So that is good. I am then going to have you say ah. Okay, and his tonsils are at a position 0. They have been removed, and his uvula was at midline there. So that is good. I'm then going to move to cranial nerve 12, the hypoglossal nerve. I'm going to have you stick out your tongue and go from side to side. And that is good, and that is intact. All right.